I think really currently we don't have a cure for dementia, but we can do a lot in terms of risk prevention and risk mitigation, meaning that there's a lot to do, especially with the refugee population and with the displaced population in general. Like I said, the homeless population, climate refugees, whom we are likely to see more of. We think that there is a lot that can be done to help these populations before they develop dementia. So, for example, uncontrolled blood pressure is a big problem in the displaced population. As we know, there's intermittent access to care, there's lack of medications. Now we're seeing it with the Ukrainian refugees and trying to think of how we can really help people who are simply hypertensive, diabetic. All of those, we know diabetes and hypertension, for example, are likely to increase one's risk of dementia. So if a person has high blood pressure and it's untreated or poorly controlled, they're likely to develop dementia. So I think there's a lot that can be done on risk factors. And actually, we're leading a study here, a small clinical trial in San Diego, to work on self-management of hypertension in refugees, meaning we're teaching refugees how to manage their own blood pressure, to measure it constantly, because we know blood pressure is a silent killer. So we're hoping through community-based interventions, working closely with ethnic community-based organizations and peer leaders and community leaders from the refugee community itself, to introduce these concepts such as self-management of diabetes and self-management of hypertension, so that hopefully this will decrease their risk of dementia. Lastly, in the future, we're hoping also community-based interventions could follow people over time, so that we see whether what we do not only controls blood pressure, but also diminishes the risk of dementia. So we can look at cases and controls and those who have been randomized and see whether really they are aging gracefully and aging while preserving their own dignity.